Hello everyone, this is Jyotsna here. Today I'm sitting in New Jersey next to a person who enjoys a very high stature in the Indian American community. And not just the Indian American community, but throughout America. His name is Dr. Satheesh Kathula and he is the president of AAPI. Well, you must be wondering, what does AAPI mean? And very simply, what I do is I'll introduce you through him only. Dr. Kathula, first and foremost, thank you so much for giving me the time to interview you.
Thank you.
At a short notice. And I definitely want you to introduce yourself to our audience in general, so that they know what is the meaning of AAPI, and of course, being the president of AAPI, where you stand, and of course, before that, introduce yourself in terms of your very vast profile that you have in the medical industry.
Sure. Thank you, Jyotsna ji, for your time, and I'm really happy to talk to you today. We have talked before, but my name is Dr. Satheesh Kathula. I'm from Dayton, Ohio, and I'm an oncologist for the last 25 years. I'm a hematologist as well, and I'm board certified in lifestyle medicine. And I did a course from Harvard recently. It's called Global Healthcare Leaders Program. And I also have a certification in artificial intelligence in healthcare from Stanford. Wow. Currently I'm seeing patients. Typically that's my practice, clinical practice, and I'm the current president of AAPI, as Dr. Jyotsna mentioned. And basically AAPI is American Association of Physicians of Indian Origin, which has about 15,000 dues-paying members. Wow. And it represents about 100,000 Indian doctors, first and second generation included.
Awesome.
So we have been in existence for the last 42 years. It was formed in a basement in Detroit years ago to fight discrimination, actually.
42 years?
42 years ago.
And it was formed in a basement to fight discrimination?
Exactly. Because
why discrimination?
Because in those days, the Indian doctors or the foreign doctors were not actually getting licenses in some states because we come from a different country. So this is what the Indian doctors fought in those days through AAPI. And now we enjoy practicing in all states thanks to AAPI.
Absolutely.
So that's how it started. And then it evolved into a social, educational, political forum. So it's a great platform for Indian youngsters to be involved in, because it's we encourage younger generation to be involved in this. And we do a lot of things here. For example, during COVID time, we collected over $5 million to send equipment to India, like high flow oxygen.
$5 million?
Like that. Yes.
That's a good amount that the AAPI doctor sent from here.
Yes, and even Prime Minister Modi addressed us in those days. He sent a video appreciating the AAPI's help. And we actually collaborate with big organizations like American Medical Association, and then FSMB, which is Federation of State Medical Boards, American College of Physicians, and so many other things. American Heart Association, we have a collaboration and MOU going on to do CPRs, not only in America, but also in India. In fact, we are doing what is called cardiac convention in India in January, on January 18th, along with American Heart Association, Asian Institute of Gastroenterology in Hyderabad on January 18th, to educate people about cardiac resuscitation and the advancements and things like that. So AAPI collaborates with big organizations. So that's one of the things that we do in America. In India, we do Global Health Summit every year. I did one under my leadership just this past October in Delhi. And we had a chance to meet our Indian Health Minister, Honorable JP Nadda. And we spent quite a bit of time really going through what are the challenges we have in India in healthcare, and also what are the challenges physicians are facing. For example, physician violence. As you know very well, unfortunately, sadly, there was a lady doctor who was raped and killed. So what kind of measures we can take, and there are a lot of angry families if something goes wrong, and how can we really calm them down, and how can we protect and give security to the Indian physicians who are practicing there. So that's what we discussed, and then how to really promote family practice there, because family practice is not a mature specialty there. But here in America, it's a very mature specialty, and we need family doctors because everybody wants to do specialization. After MBBS, they want to do MD General Medicine, MS Surgery, Orthopedics, or and primary care is actually vanishing in India. It's not a good trend. So that's why we want to promote.
So when you
family
speak
practice.
about promoting family practice in India, as in terms of these physicians, doctors in general, right?
Yeah.
How are you going to promote that? The vibe that you are creating, that people should get into family practice medicine.
So, but first of all, we need to create the postgraduate programs. So we are recommending every every hospital or university should have this program so that people can join. They want to do some post-graduation, a lot of them do. And instead of going into general medicine, they can go to family practice where they can treat children, they can treat women, they can treat anybody, adults.
Absolutely.
So that's what we are trying to encourage.
Very nice.
To create that program. So we had a very good meeting in Niti Aayog, and there are a lot of Niti Aayog members who are there, Dr. Abhijat Sheth, Dr. V.K. Paul. We spent quite a bit of time with them to actually tell them the importance, explain the importance of family practice and why we need family practice in India. And they know the importance of that. And they said they will increase the departments of family practice across India, and also they want to increase the positions like postgraduate seats in family practice.
Interesting.
And they want to do that, and they clearly understand how this trend is going. Not having enough primary care physicians in India, and everybody is a specialist now, and the trend is going to get worse because every MBBS wants to do PG.
Yeah, that's the sorry state is in India. People don't consider an MBBS the ample qualification to be.
Exactly. Yeah.
I mean, of course, even if they have little GI infection, they would like to go to a GI specialist instead of a physician.
Even for simple diarrhea, they go there. It's waste of resources. And not only that, they have to travel so far to see a GI specialist.
Right.
When they can have somebody.
I mean, there's a lot more to talk on that. Keeping the constraint of time, Dr. Kathula. Let's come back to America. And when it comes to AAPI, how are you, getting involved with the youth here for the Indian American community per se, or even the youth?
Sure.
What are you aspiring to do here? Because this is another generation that is, of course, coming up. They are going to take care of us when we grow old.
Absolutely.
What is AAPI doing here?
Well, now this year we are focusing on several things. Number one, we want to focus on legislation. Number two, we want to focus on clear communication. Number three, we want to encourage younger generation. Number four, collaboration with other organizations. All these, and education. These are all the things that we want to do this year, and we are succeeding in a lot of things.
So what are the immediate things coming up soon?
So the immediate coming, we are actually doing what is called MSRA, which is Medical Student and Resident Forum meeting in Rutgers, right here in New Jersey, on January 25th, 26th, and 27th. And we are actually asking students to send their poster presentations of papers, research papers, so that they can present here. So last year there were 250 people who attended that. Not only the American students, but also the students who are coming from India to do residencies here. So they're also being part of this MSRF.
So when you talk about students at the Rutgers University, are these the only students of Rutgers University?
No.
They're open to any medical student throughout America?
Everybody
in America. Throughout America.
Yeah. And we did what is called a young physician section. That's another section. These are the people who finish their training. They're in practice less than 10 years. And they are in that YPS thing, what is called a young physician section. And we just had a meeting in Washington, D.C. last month. And that was, successful in the sense that we had great speakers, and even Bobby Mukamala, who is the president-elect of AMA, he was one of the speakers there virtually. But it was a very well conducted meeting, and we do that every year through YPS. I mean, my goal, even when I was running for elections, one of my election agendas was to actually encourage younger generation. I have two children who are in medical profession, so I always encourage them to be involved. This is a great platform for younger generation to really express their views, voice their concerns, and then to move up. I mean, in life, they can be president of this organization, they can be on the executive committee, all these boards. They can chair a committee, and they can get very good experience in these medical organizations.
Absolutely. See, more youth you add, more energy you get.
Yeah,
and that energy gets dissipated in a positive manner.
There is no question about that, and there is a lot to learn from younger generation. And whenever I go to their meetings, they conduct themselves
Well,
very
you're
well.
talking about artificial intelligence.
Yeah.
There's no better bet than the young generation, participating in this.
No, their technology is savvy, and they
Right.
do really good in terms of bringing quality speakers, quality programs, and I always enjoy going to their conference. I attend almost every year. I've been doing that for the last 4 or 5
Absolutely.
years.
Dr. Kathula, you know what, I have known Dr. Kathula for almost a decade now. And the beauty is, he's a person committed towards the community. Very decorated. Well, congratulations,
Thank
Dr.
you.
Kathula. You are receiving an award today as well.
Yes.
So, I
Thank
mean,
you.
we'll talk about that as
Sure,
well.
sure.
But then, the person who sits here, he thinks about community, and he has done a lot of social work for the community, cause-driven work. In fact, even now, I think you have certain other plans that
Yes,
are coming
yes,
up or
yes.
materializing. So, can you please share that as well, when
Absolutely.
people can join?
Yes,
thanks
yes.
to them.
I worked for Leukemia Lymphoma Society before I was named Man of the Year for raising funds for that. I came here
Nice.
several years ago. You all helped me at that time.
Absolutely.
And then, recently we have done what is called Adaptive Village program in India through AAPI to actually, screen for non-communicable diseases, which are silent killers. They don't
Right.
have any symptoms. For example, hypertension, high cholesterol, and then, chronic kidney disease, diabetes,
Right.
anemia, all these
Right,
things
right.
we have. I actually screened 10,000 patients
Wow.
in India in 75 villages
Wow.
to commemorate 75th India's independence
Awesome.
year.
That's excellent.
So, and now currently we are doing what is called stem cell collection or registry at least, because I'm an oncologist. I see patients with leukemia, lymphoma who need sometimes bone marrow or stem cell
Right.
transplant. For that, you need a matched donor. But unfortunately, the South Asian pool is very small. Indian and South Asian pool is very small. For example, if a Caucasian gets leukemia, lymphoma, if they need a donor, there is 30%, 20 to 30% chance of finding a donor.
Right.
Whereas for Indians or South Asians, it is less than 0.0%.
So let's come back to the ground reality here.
Yeah.
And of course, being a general public, we don't know much how it is done or how they create a stem cell. How is the process of collecting the samples,
Sure.
keeping the records? Tell
Yeah.
people, because
Absolutely.
that's where they hear about it. And of course, if somebody is luckily found as a donor, how the transition goes into like donation of the bone marrow and all.
It's very easy.
That we must
Yes,
tell people.
yeah,
There's
absolutely.
always a fear or some
Yes,
miscommunication.
yes. A collection of stem cells is easy, but before that, if you want to be registered in the registry, you have to be between 18 and 40 years of age. All you have to do is take a swab from your cheek and then send it to the registry, and they keep that in their registry.
So you just take a ear like bud and this
Yeah,
collect
that's
the
it.
saliva
And
samples. Wow.
if they need you,
Right.
if they need you in future for
Right.
somebody, it's very easy process to collect stem cells. When I started my oncology practice 25 years ago, we used to drill into the bone marrow to get the bone marrow sample and
Oh my
then
God.
collect. But that's not the case anymore. Fortunately, it is actually collecting stem cells from your vein.
Oh, interesting.
Yeah, we just put a line and we collect the stem cell.
So it is not that complex which used to happen
Not
earlier.
complex at
It
all.
just simply goes
Just
to collect
simply,
the bone marrow.
it is very easy.
So how much time does it take?
It takes
for transplant?
hardly like half hour to 1 hour.
To take the sample.
To take the sample, the
Perfect.
cells.
Oh, the cells.
Yeah, the cells, and they collect stem cells and they store them.
Right.
And then when they need, actually they give it to. I mean, usually it's a need-based collection.
Absolutely.
So if
absolutely.
somebody matches with, Ms. Sharma,
Right.
and then they contact you,
Right.
and you go there and you give yourself.
Absolutely. And Dr. Kathula, I am a registered bone marrow donor.
Awesome,
And
awesome.
I have registered myself. I've registered myself almost 8 years back. I was also not aware then, but yeah, it was a simple sample of my cheek, just rubbed some bud there and then took it out. Very simple. So again, let's come back to AAPI now in terms of the activities and things that you're planning for future. What are the other next plans, just for the people to be
Absolutely.
aware about?
No,
And one more thing, how to connect with AAPI if there are other physicians who are
we
still
do
not
have
part of it.
website. We do have
Right.
website, and there is membership. It's only $100 lifetime membership. It is one of the
Interesting.
cheapest memberships you can ever get. You can be part of AAPI just by paying $100.
Right.
And then there are so many benefits like networking, going on tours, knowing people,
Right.
and then getting involved in any AAPI project that we are doing. All you have to do is send us an email that you are interested, and we can certainly accommodate you in anything. If you're a volunteer, we would love to have you. So that's one thing. And We are having tours to Japan, Arctic. They can actually join us for
That's
CME.
nice.
Those are all like family, friends, educational events. We have CME in that. Plus, it's great networking opportunity to meet people across the country. And then we have what is called annual convention in Cincinnati from July 24th to 27th, and we'll be doing our annual convention. We are planning to invite dignitaries like governors, senators, president, vice president. And I even sent a personal invitation to Health Minister in India too recently.
Very nice.
We would love to have dignitaries and a lot of CEOs, healthcare related, and then a lot of academicians. And I was talking to some of my friends today to bring some Nobel Peace laureates and that kind of thing, just to inspirational talkers, keynote speakers. So we want to do that. And then, of course, the stem cell drive, and then encouraging younger generation.
Right.
These are all the things.
Let's come back to one major part here.
Sure.
But people, as you're aware, that in US, the people who come on the high-skilled immigrant visa, of course, doctors, physicians also are part of that visa category. And when they come to this country, they are stuck in a very, very huge green card backlog. That means when they come to this country, they'll have to wait anywhere between 20 to 40 years to get a green card, get a permanent residence here. So what is AAPI taking, the initiative that AAPI is taking? I need to know about that, because of course anybody who's watching, the doctors who are in the mess, how they can align with you, and what is AAPI doing for them?
That's a great question, and we have been advocating for that for the last 4 or 5 years now. And there is an organization called PAHA. So this is physicians who are on H1 visas, and we do have those on AAPI Executive Committee now, and we are collaborating with PAHA to actually help to get their green cards faster. So it is a crisis, we should say, because we need doctors in this country. We need 85,000 doctors in the next 10 years.
Absolutely.
So there's a huge gap. But how do we really close that gap is one question, and how do we retain the physicians that we have already in this country? And there are at least 12,000 Indian doctors who are on H1 visas, and they have been waiting for their green cards for over a decade.
Absolutely.
So, but they are insecure because if something happens to them, their family has to go back. And their children are here going to schools, and even they don't have a chance to really stay back for God forbid something happens to the doctor. So that's why they all have to get green cards as soon as possible, because they cannot be combined with other professionals.
Absolutely.
Because these are the people who are high skilled workers, immigrants,
Right.
and they have to be given priority. They have to just do that as soon as they can. Otherwise, it's going to be a crisis, because some healthcare systems are totally dependent on H1 visa holders.
Wow.
If they leave, actually there is a crisis in healthcare system. The healthcare system in some cities, in certain, for example, South Dakota, North Dakota, will collapse.
Wow, look at that.
Literally will collapse. I mean,
these are the Indian H1Bs, or say
it's like
H1Bs in general who are taking care of the people
80% of the doctors
My
in
goodness.
some cities, in some states, are immigrant workers,
Absolutely.
immigrant physicians who are on H1. So it is very, very important to retain
And
them.
displacing them from this country is not a good idea. If they don't get their green card, their kids came when they were too young, or not even born, they were born here. But then if they don't have a green card, the kids age out and they have to leave this country, or otherwise they have to come on a student visa to retain their stay in this country with their parents. This is a very sorry state, and I myself have done advocacy for the high-skilled immigrants here, for the green card backlog, and I am a co-founder of a high-skilled immigrants for America non-profit, Dr. Kathula. In fact, we would love to align with AAPI on this case,
we
take
would
it
be
further.
happy to.
Because
would be happy
we
to
had
align with
presented
anybody
2020.
who's advocating for that.
Absolutely, 2020 we had presented a letter to President Trump, to remove this, and in fact President Trump supports the high-skilled immigrants,
workers.
and he spoke about clearing the green card backlog as well.
Sure.
And first and foremost, his focus is to give green card to the kids, at least, who are legal, documented dreamers here in this country. So, Dr. Kathula, in fact, very interesting conversation with you and your plans, as you have revealed about. So, what is the final message to the youth from AAPI? Why I'm saying this? As a general person, when we look at AAPI, of course, what we have seen on the social media is the parties AAPI have. Well, there are amazing singers, Bollywood stars who come to AAPI along with politicians, and we get to see that only. And okay, doctors are having good time, fun time, and enjoying. But there's a different side of the story where AAPI is committed for the community here in general. So the message should go to the youth to align with AAPI because there is more meaning that you're adding.
Absolutely.
One message, and for the community in general.
Yeah. So get involved. Get involved with AAPI, and we need help, our viewers, and help us help you, basically. So this is your own community, and this is a physician platform, and there is no other organization for you actually as physicians, young physicians. And please join us, guide us, lead us. Thank you.
Thank you, Dr. Kathula. One last request. When Indian American kids look for internship, we seek help from you. You must help as AAPI to give them internships.
Absolutely. We are actually having a mentorship program. In fact, in February, we'll be doing a webinar, not only for medical students, pre-med students as well, and those who are actually looking for residencies after their medical school.
Awesome.
People who are coming from India and others, especially India.
Right.
And we want to really mentor them. And there will be a bunch of doctors who are actually mentoring them, and this will be a series of webinars we'll be doing.
Right.
And this will be starting in February.
So guys, I will provide those links to you wherever this message goes, whether it goes to the news channels or to the social media. You will find the connection. My task is to connect the right people with you, and that's the zest for today. Of course, thank you so much, Dr. Kathula, for joining us.
Thank you so
and
much.
Thank you for doing the great work. Keep up the work, good work, and more power to you is what we would.
Please visit our website, aapiusa.org. Thank you.
You got it. So I'll come back with another interesting episode. As of now, signing off. Thank you so much. Stay blessed, stay happy, and stay healthy.